All right, if you're on the East Coast, I want to say good afternoon. And then if you're on the not in the East Coast, anywhere else in the States, good morning. Thank you for joining us this Friday at our NMQF webinar, where we like to take our opportunities on Fridays to sort of educate and entertain you about what's happening and some big issues in the healthcare space. As you know, we've always been working a lot in breast cancer care, and this program will be a testament to that. Our very own comms teams will be taking the lead on it, head by our Vice President Adjoa and Taylor, who's going to be leading it. And then we have other folks on the panel that you may be familiar with, like Natasha Gatson and Ashley Lee, who are gonna join us. The title of today's program is Strengthening Breast Cancer Care Through Shared Decision Making and Health Literacy. And so we're looking forward to hearing this conversation. But before I turn it over to Adjoa, I just want to remind everybody that if you have any questions for the panelists, please place that in the Q&A box. And then if you have anything you want to kind of like some facts or some interesting tidbits you wanted to put in there and discuss, please put that in the notes. And Aja will make sure she tries to through both of them to make this, so as it says, a very interactive event. Additionally, we are 30 days from our National Annual Summit on Health Disparities, where you can see us, I guess, in person and participate. And so if you have any questions or want to do that, we'll put a link to registration or more information about that. Great to see you virtually today. Hope to see many of you in person in 30 days. And without further ado, I'll turn it over to people far more experienced and experts in this space, starting with Ajua.
Hello, everyone. Good afternoon. If you haven't here yet, this is a good time to grab your glass of water or your little piece of food and sit down and get comfortable. And then also share the link with some friends because you look around like, wait, who's not here? Yeah, go and make sure that they are part of this webinar because we're really going to get into some critical conversation today. We're so excited to talk about breast cancer care through shared decision making. Shared decision making is a hot topic right now for a number of reasons, and how do we improve health literacy, particularly for our communities that really need that patient navigation and support and that empowerment. And so the Center for Communications and Public Affairs is really excited to have this conversation with partners that we love to work with and patient advocates that we love to amplify and platform. And we're so excited by those of you who have already submitted your questions. But if you haven't, please use the Q&A function and there'll be polls later on for you to take. So this is what I'm saying to you, that this is interactive. This is interactive conversation. We really would like you to participate. And this conversation is really highlighted and we're really having this conversation because of the work that the Center for Communications and Public Affairs at NMQF, the comms team, does through the Lift Every Voice program, which is our health literacy program. It's a program where we work directly with patients through our patient networks, including the Support Our Sisters with Metastatic Breast Cancer patient network. And like Brandon said, this conversation will continue at the April Summit. There will be a communications convening at the April Summit this year on April 28th from 8 a.m. to 12, of which we will be exploring the same themes and conversations in person in a much nicer space at the Conrad Hotel. So without further ado, I do want to introduce my colleague, Taylor Lopez, NMQF's Health Communications Director, who's going to guide us in our conversation today. Taylor?
Thank you so much for that, Adjoa. Thank you all so much for joining us today for this very important webinar. Just as Adjoa, I'm really excited for this conversation because how we communicate in healthcare directly shapes how patients experience care and then ultimately their outcomes. So healthcare delivery is constantly evolving, and effective communication is at the center of patient trust, engagement, and outcomes. So today we're going to explore a few things. One, how shared decision making shapes patient care, how health literacy influences patient understanding, and then how strategies uh, clinicians can use to support patient engagement. And so this session is designed to be interactive and reflective. So I really encourage you to think about your own experiences as we move through today's discussion. So your insights will definitely help inform future resources for providers nationwide. So today, here's what we'll be doing together. We'll begin by grounding ourselves in shared decision making and health literacy. Then we'll hear perspectives from our panelists across clinical care, advocacy, and lived experience. And we'll also engage in live polling and discussion. And throughout, we'll hear real world insights on how communication shows up in practice. So now I would like to introduce our panelists. You are familiar with Adjoa, but I'd like to now introduce Lindsay Livingston. She is the founder and executive director of Survive Her. Ashley K. Lee, she is a healthcare advocate and community activist. And Dr. Natosha Gatson, who is a leader in neuro-oncology. And each of them brings a very unique and critical perspective, really helping us understand how communication impacts care from multiple angles. So why does this conversation matter? Well, today patients are being asked to make increasingly complex decisions about their care, but a lot of patients still experience challenges such as difficulty understanding medical terminology, navigating treatment choices, and then feeling unsure about asking questions. And when communication breaks down, trust can really erode. But when communication is strong, it supports things like better understanding, greater confidence, and then more meaningful participation in care decisions. So one of the reasons why we're here today, what is shared decision making? Well, it's a collaborative process. So it means providers bring their medical expertise, patients bring their values, priorities, and preferences, and then together between the patient and the healthcare provider, decisions are made. And so some of these key elements can include things like clear communication, explaining options and risks, understanding patient priorities, and then again, making those decisions together. So I'm going to ask Adjoa to come on for our clinical perspective with Dr. Gatson.
Thank you so much for that walkthrough. Again, I'm actually going to take a step back for a second and see if I can go back a slide. No, is that not going to work? No. Okay, never mind. Hopefully we all paid attention to the slide about what is shared decision making, because, you know, I think that even though there is a clear definition, there are different approaches, right? Of which folks like to think that they're implementing shared decision making. And we really have Dr. Gatson here because at NMQF, we love her approach. And, you know, we like to think about shared decision making in the context of cultural competency, you know, particularly, you know, how can we make sure that we're reflecting patients and in where they are with the kind of unique challenges they might face. So Dr. Gatson, with that said, I raised the bar for you. You know, how do you approach shared decision making when patients are facing difficult treatment choices?
Yeah, thank you very much for this question. And thanks everybody who's joined and for having me on the panel. So I deal with a significant number of patients suffering from breast cancer, and not just breast cancer, but the complications of the treatment for breast cancer. Some of those complications have to do with the financial toxicity of the therapy. So it's not just what the drug causes, it's not just what the cancer causes in their life. Sometimes it's our decision making in deciding to request a treatment that is financially burdensome, or the necessity to get back and forth to the institution to get a certain type of treatment that may cause a travel financial burden. We have to approach patients holistically and understand that just because something is written in the guideline, it doesn't necessarily follow the guardrails in people's lives that make life worth living. I talk to my patients and I make sure that they understand that, to me, the most important thing is that we decide together how to move through the journey called cancer care. Unfortunately, all of us are born with this terminal condition called life. Life is a condition that ends in death, and there is no cure for that. But there is a treatment, and that treatment is living. And living has to do with being involved in that decision making so that you can choose if I don't want to get the treatment on this day because I have to go to a graduation or I'm watching my daughter get married. Can you hold off the treatment for 1 week? The answer to that is yes, if it offers living and it won't, there's no evidence, there's no scientific evidence that this would cause the tumor to progress in a way or at a velocity that is unreasonable. We can make those decisions with patients. And so when I started at my institution, and I'm the director of all of the brain tumor that happens at Indiana University Health, surgical, medical, pediatric, adult, skull-based, we do it all. And as that director, I make sure that they understand that my approach to treating patients is compassion first. I don't have new patient slots and return patient slots. Instead, I have 40-minute slots. I can see all new patients or I can see all return patients. That doesn't matter as much to me because if you understand your craft very well, there is not a new brain tumor in the world. There's not a new breast cancer in the world. What there is new patients. And with new patients comes an understanding and a need to understand their values. So when I see a patient, the way that I make sure that shared decision making is at the fore is that I ask in the very beginning, what are your values? Is it that you cannot travel back and forth? Do you not want to have a treatment approach that would cause you to have these types of delays or these types of complications? And when we craft a journey that is evidence-based but compassionate, patients always feel informed and they always feel supported. But more importantly, they trust the path forward.
That is so profound. Would you say that you've encountered this quite a bit where patients are, it's not truly a choice, maybe in their eyes,
Yeah.
regarding treatment choices or whether they participate in a clinical trial because they have real financial or other kind of life constraints? Have you seen that quite a bit in your practice?
Yeah, unfortunately, patients feel, and a lot of times they hesitate to ask the physicians the questions about, well, how is this going to impact my quality of life? Can you tell me what the financial burdens are? They think that these things are somehow outside of the scope of being doctor. To me, when you're a doctor for someone, you have to consider those things. Not every treatment is for everyone. I happen to be one of the people who writes the guidelines for the world for brain tumor. And in writing those guidelines, I understand that this is the minimum possible approach that you can take to treat a patient with evidence. But beyond the evidence, nobody factors in what's this going to cost the family? What's this going to cost your cognitive capacity? What is this going to do to your quality living? What is your idea of quality living? So patients, they're unfortunately they don't ask all the right questions. Because I've seen this so many times in my practice, I stepped away from the day to day being a doctor and started my own nonprofit foundation called Living Oncology. And through Living Oncology, I give patient health literacy questions to ask that they would not have thought of otherwise. Patients come in and they ask, well, what's going to be the side effect of chemo? What am I going to deal with this radiation? How am I going to change? How do I modify my makeup approach after the surgery and I have this scar? Those are some of the questions that patients ask. They don't think to ask how many caregivers are going to be needed to help me through the day? How do I battle my job, my employer, because they're going to have a place where they don't want me to take these days off? How do I navigate FMLA? As a physician, if I don't have social workers available to even present those questions to them and ask those before the patient asks a question, then I'm not offering this patient best care.
That goes right into our next question. How have you been able to ensure patients feel informed and supported? What kind of environment did you create where they felt comfortable to ask you those questions? How did you go about that?
So first of all, I understand that they're probably not going to ask those questions first. So I present those questions and I make sure that my 40 minutes in the visit are not about here's the name of the chemo, here's the name of the dates that you have to take it. It's about what are your values once again. And so I present those questions to the patient. But beyond that, I've instituted a chaplaincy program where we're dealing with their spiritual well-being. I make sure that a social worker is available to see those patients. And I offer multiple follow-up touch bases. We call those wellness or well-check visits, where I'm just checking in to see, did you develop any questions after we hung up, 2 weeks ago? Does someone else in the family have any questions? Can we get them on the line? Let's do this as a virtual visit. So offering touch bases and making sure that you don't wait for the patient to ask the question. As the professionals, we know what they're going to go through. We know what's ahead of them, and not everybody has endless money. So it's important that we ask some of those questions right up front.
Thank you so much. And keep submitting your questions. We see them. We'll be getting to questions towards the end. With the comments that Dr. Gatson made, I wanted to reference the Support Our Sisters survey results through our listening lab, NMQF comms Lift Every Voice listening lab, and 45.8% of respondents reported of an income less than $50,000 per year. These are women of color with metastatic breast cancer, so less than $50,000 per year. So you can imagine some of these treatment choices, what that means for them, and how much we have to be cognizant of these constraints.
Can I just say one thing, noting that, Adjoa, one of the medications that I give for patients, it costs $52,000 per injection. So imagine that. And you give the injection once every 2 weeks. Right away, that's in 2 weeks, someone's entire year's salary gone. So those are the problems that we face in this field. And I want to make sure that we're prepared to address those.
So amazing. Taylor, over to you.
Yes, thank you, Adjoa. So now I want to take a bit of a deeper dive into health literacy, because it's really at the center of everything that we're talking about today. And health literacy is often defined as a patient's ability to find, understand, and use health information to make decisions about their care. But in practice, it's a lot more than that. Health literacy isn't just about a patient's individual skills. It's also about how well we as providers and communicators present that information. And even highly educated patients can struggle when information is filled with medical jargon, is delivered way too fast, or it comes at a moment where they're feeling just completely overwhelmed or afraid. And that's especially true in breast cancer care, where patients are navigating both emotional stress and complex treatment decisions at the same time. And there are a few key factors that influence health literacy in real world settings. So first, medical language. What feels routine to us can feel confusing or even intimidating to patients. Next, emotional stress. So when someone is feeling anxious or they're processing a diagnosis, it can become a lot harder to absorb information. Next, information overload. So patients are often given a lot of information in a very short period of time. So just imagine that you've just been diagnosed with, metastatic breast cancer, and you have this 1 hour long appointment. Like, it's kind of hard to digest what you're being told in just that short appointment time. So, and then fourth, system complexity. So navigating referrals, treatment options, insurance, and follow-up care can all be overwhelming. And I also want to name something important. Health literacy is deeply connected to equity. Patients from historically underserved communities may face additional barriers, including things like limited access to clear and culturally relevant information, mistrust in the healthcare system, or prior experiences where they feel like they weren't heard or respected. So when we talk about improving health literacy, we're really talking about making healthcare more accessible, more understandable, and then more responsive to patients' reality. And at its core, it's about shifting from did I explain it to did they understand it and then feel confident in acting on it. So next, we're going to hear from the patient perspective from Ashley K. Lee. And Adjoa, you can take that one.
Hi, Ashley K.
Hello.
We're so glad to have you here. Your journey is quite a story. We're always glad to platform you because of, how you've been able to overcome your challenges. And so with that in mind, what moments in your care journey that you can identify, that you can recall,
Mhm.
made medical information easier to understand?
Mhm.
And maybe even you can share difficult moments when medical information was hard to understand.
Okay. I love that question, and thank you guys so much for having me. Um, I would say the first thing I would talk about is when it's hard. So for me, I got diagnosed kind of late in my breast cancer journey. I got diagnosed a few days after my 26th birthday. So I'm 26. I'm still like in the prime of my life. I'm trying to figure life out because now I'm dealing with cancer. And I go into the office, and even though I have pre-med knowledge because I was in school at the time, a lot of the language wasn't language I was familiar with. So I wasn't familiar with like Hertz negative versus Hertz positive. I wasn't familiar with the staging of breast cancer. I wasn't familiar with tumors versus it affecting the lymph nodes. I wasn't familiar with a lot of the dialogue. And so when that information was given to me, right after them telling me, oh, well, you're going to have this surgery, I'm already like really emotional. And so them throwing all the information at me at one time, like, here, this is what we have for you, was a lot to take in. So I end up having to like go do my own research. And anybody that knows that if you go start Googling stuff, Google's going to make things way worse at times than if it could have been explained like in a more reasonable like explanation. Um, but I will say the easiest thing has been when I actually got the chance to talk to a patient advocate. And I talked to her and I asked her, like, well, can you explain to me what my type of cancer is? Can you explain to me how it would affect me? Can you explain to me what it would require me to lose my breast? Because I'm 26. So the idea of that is fearful for me. It's me losing a piece of my identity. I had already lost my hair, and now I'm like, okay, am I going to lose a body part? And having someone who can like break things down in a more layman terms for me allowed me to be able to process everything that was told to me, but also allow me to have the open conversations with my friends and family because now, okay, I understand and I can explain it to them so that we can have like a more open conversation because I care about what they have to say as far as my health too because these people care about me. And so if I can relay information better to them, they can relay their feelings better to me so then I can have like a more cohesive care plan when it comes to like making sound decisions.
Thank you for sharing that. What has helped you feel confident in participating in decisions about your care? You mentioned, for example, having a patient advocate.
Mhm.
You could talk a little bit more about that, or maybe share other things that have helped you in the past to be more confident about making decisions when you're presented by your doctor?
So for me, a lot of it had to do with the patient advocate. And then a lot of it had to do with also being able to talk with like family and friends and hearing from them different perspectives because they're on the outside. So sometimes when you're dealing with something and you're personally dealing with it, it's hard to take your emotion out of it and make a sound decision sometimes. So when you have other people who maybe aren't as emotionally invested as you are, you're able to get like other perspectives and kind of be able to sort out these different thoughts that maybe you wouldn't have thought of because you're in the emotional chaos of it. But also another thing for me was being able to talk to other specialists. So the doctor that diagnosed me wasn't the doctor who created my treatment plan. So when I was able to actually speak with the doctor who did my treatment plan, I was able to ask more questions that they could answer because that was their specialty. So that made it a lot better as well.
And do you recall at any time if your doctors presented you any clinical trial options, or have you heard from other patients like yourself if they were presented clinical trial options?
So early on, I was presented a clinical trial option, and I had gotten very excited about it. But they had told me about it before they had like looked at my actual um, diagnosis and what my actual problem was. And so maybe a week or so later, I found out I didn't qualify for it. So it kind of felt like a letdown because I was like, you got my hopes up that maybe there was something that could have cured me or helped with my quality of life. And I was kind of like snatched away because you didn't look into my actual case versus like, for the clinical trial. So that was like really disappointing for me.
Yeah, we're gonna get into that more. Um, Over to you, Taylor, but before you pop back in, just wanted to share that fears and anxiety is a rampant issue, amongst breast cancer patients, particularly from underserved communities, and that in our survey that I've shared the link to, many feared missing the proper dose for their medications.
Mm-hmm.
Many felt fearful about their treatment options. And so, many were concerned about things like side effects. So, um, that sort of advocate being able to walk through and really have the patience, and I know we'll talk about that too, is truly important. Over to you, Taylor.
Thank you, Adjoa. So we've reached our first poll. We'd really appreciate if this applies to you, select one of the following. Have you received formal training in health literacy or culturally responsive communication? So you can go ahead and select the option that best reflects your experience. So we'll take a few moments for you all to select.
Has the poll been launched? Let's see.
Oh, there we go. We'll just take another few moments for folks to get their answers in. Okay. I think at this moment, we're going to go ahead and go through all of the poll questions. So the second poll question, how often Do you intentionally use shared decision making when addressing treatment or care options with patients? You can go ahead and make your selection now. Poll number 3, what strategies do you commonly use to support patient understanding? Poll number 4, what are the biggest barriers to shared decision making in your clinical environment? And then the last poll, number 5, when patients have difficulty understanding health information, which approaches do you find most effective? Okay, we are going to also try and reshare the poll so that everyone gets a chance to um, answer the questions.
Unfortunately, I think when we relaunched it, it cleared the previous respondents. Can everyone see the poll? If you can try to re-enter your answers, we'd appreciate it.
Right, we'll just take a few more moments for folks to get their answers into the 5 polls, and then afterwards we will move on to Lindsay from Survive Her. All right, we're going to go ahead and wrap up. Thank you all to those who participated in the poll. We really appreciate your answers. Your answers, again, will be used to inform the resources that we create in the future for our healthcare providers. Next, I would like to pass it back to Adjoa and Lindsay.
Oh, Lindsay, I think you can see some of the responses here, and it varies, right? As far as the kind of training people have gotten in regards to health literacy and shared decision making. And I think folks are looking for guidance. Through your work with Survive Her, what communication challenges have you seen patients most often describe when interacting with providers?
Thank you so much, Adjoa, and thank you to NMQF for this opportunity to lend my patient advocate voice to this conversation. And I also want to mention that I do come with lived experience. I was diagnosed with triple negative stage 2B breast cancer in 2019 and was highly uneducated about breast health, breast cancer, genetics. And so that was the impetus for me starting Survive Her, is to simply educate women and to empower them to ask questions and to improve their communication as they're communicating and talking with their provider. So some of the communication challenges that women often share with Survivor, number one, feeling rushed or dismissed. When they walk into that exam room, they feel like it's an appointment that's transactional, and they leave thinking, I had more questions to ask, but I was rushed. And that creates the hesitation for them to speak up the next time. So, providers being mindful of really being intentional about that time in which they are engaging with the patient who has recently been diagnosed and has received those daunting words, you have cancer. Medical jargon overload. Let's provide clear communication in terms that are familiar. Oftentimes, when patients hear those unfamiliar terms, they're confused. And that just, again, presents another communication barrier. Lack of culturally responsive communication. How you communicate with a Black woman is very different from how you communicate with a non-Black woman. There is a disconnect in tone, I've heard, relatability, understanding their socioeconomic status, and the weight that they carry into that clinical setting. And so that disconnect or lack of understanding rather could impact trust that the patient would then build, or lack thereof, build with the provider. Fear of the answer. They don't ask questions because they don't want to know what's on the other end, what's on the other side, treatment, surgeries, et cetera. As Ashley Kay mentioned, when a woman is diagnosed and she has to go through chemo, we don't want to know that we're going to lose our hair, our breast, and other body parts. So that also presents a communication challenge, and simply not knowing what to ask. You are new to this. I was new to it when I was diagnosed, and I appreciate Dr. Gatson equipping her patients with a guide and encouraging them to ask certain questions. And so in Survivor, we really try to provide some type of framework so that we can help patients communicate effectively with their providers. Adjoa.
I appreciate that. And you kind of touched on it, but I don't know if you would like to further expound on, you know, because we've been talking about this for the past 35 minutes or so about creating that sort of environment in which patients feel empowered to ask questions, to not even just ask questions, but raise issues, right? Like per Ashley Kay's story, where, she was presented options that didn't match the type of cancer that she had and maybe the concurrent issues that she has. And often patients are managing, their care team by themselves, with different folks that they're interacting with. So, what advice would you give, to help improve, the environment in the doctor's office, for patients to feel comfortable raising issues or asking questions?
Sure. What I found to be very effective is when providers provide explicit permission for patients to ask questions by saying, stop me at any point. What questions do you have for me? How can I elaborate or clarify? I think just those simple touch points will help to break those barriers. Feeling seen and not just treated. What I appreciate about my dynamic breast surgeon, Dr. Jamie Terry with Texas Breast Specialist here in Houston, is that when I was first diagnosed, she sat me down. I took a journal to my appointment because I wanted to be an A+ patient. And she told me, Lindsay, put your journal to the side. She sat down with me and she, made eye level, at eye contact. She held my hand and she said, you're going to get through this. 90% of this is you listening to me, following my instructions. I have a dynamic treatment plan for you. 10% is what you do at home, etc. She's like, but you're going to get through this. But I felt seen. I felt heard. She was very intentional to make that eye contact, that connection. And immediately I just took a deep breath, a sigh of relief. And I said to myself, I'm going to get through this and I'm going to beat this breast cancer. But when the provider really does listen to the patient and makes that patient feel seen and heard, it just breaks down those walls. So that's what I would highly recommend to providers. And preparation tools, knowing what to ask and how you can be supported really can increase one's confidence. And with Survivor, we really try to equip women with a guide, a question prompt sheet, what to ask during your mammogram. And simply educating oneself before the appointment will help to increase patient confidence. And finally, representation and trust building. I'm really proud of the work that we're doing here in Houston and beyond to create safe spaces for women to connect with healthcare providers. We recently hosted a pink lounge at the MLK Center in partnership with Harris Health. We created this pink space on Valentine's Day for women. And we created this experience during which they could ask questions, any questions they had for healthcare providers. And they immediately felt like they could trust them. But creating safe spaces, trust building spaces is so important in this work. And it helps to bridge the gap and really break down those clinical walls to those walls that are more embracing, more comforting, and more confidence building.
That is amazing. Thank you so much for that. I'm sure people were writing notes as you were sharing those strategies. I will say that it is that concept too, because for us, we wish there was a Lindsay in every city, in every town, and a survivor. But there often isn't, and those a lot of breast cancer patients of color can feel isolated in their journey, and hence the creation of support our sisters with metastatic breast cancer, which we are so glad to have partners like Lindsay with Survive Her, like Ricky Fairley with Touch, and Tiger Lily. So, as we try to compile resources, and there's always more patients to reach. Over to you, Taylor.
Thank you, Adjoa and Lindsay. So I just want to open up now just for a little bit of reflection with all three of our panelists. So communication really has the power to transform care. I first want to let's go to Dr. Gatson. Just thinking about a moment when a shift in communication made a real difference. Dr. Gatson, when just thinking about a moment where you were working with a patient, and you were communicating with a patient, what happened? What made that difference when you were communicating with them? What changed that made them go, oh, you know what, I understand now. I know what I should do now. I feel more confident in my care decision. What was communicated that really made that real difference for a patient of yours?
Thank you for that question. I can tell you that Lindsay and Ashley Kay may right away be able to agree and understand where I'm coming from here. The first job that I took after uh, finishing my neuro-oncology fellowship at MD Anderson Cancer Center in Houston, where there are some powerful folks there. Lindsay is a great example of that. I moved to a very rural town called Danville, Pennsylvania, and at the hospital called Geisinger Health. This rural location had about 4% minority, period. It was mostly Dutch, Amish, Mennonite people in that community. But I took this job because there was an opportunity to bring the most powerful education and care to the most vulnerable people. And I went in with the mindset of vulnerability, not color, not trying to communicate based on this is a female, not going in if this person looked like me or if I had someone in the family with the same diagnosis. I went in as a woman, understanding vulnerabilities, as an educated physician, understanding vulnerabilities. And this was a very vulnerable population. And when I walked into the room, it was an Amish family, and I felt immediately this look of who's doing my care? They saw the differences. They saw at that time I was younger, and they thought, who is this? At the time, I used to have my hair in two ponytails, two, just ponytails there. And they thought, who's this black teenager coming in to take over my brain cancer care? This is serious. I got that feeling right away from this family looking at me. And it took 3 minutes of communicating with them at eye level, Lindsay, at and not minding putting my hand on a knee or reaching out to be close and say, I know this is scary. I know you want to take a lot of notes and Google always ends in disaster, but I want to talk to you. This is exactly what a good communicator does. And you open up those lines of communication when you don't hang on the fact that this is going to be high level. I'm very well educated. I have 2 doctorate degrees. All of that falls by the wayside when you're looking in the eyes of someone who is afraid and they want to be that A+ patient. Lindsay, Ashley K, you want to know it. They boosted you up. They got you ready to understand something. And then you were let down by the person who couldn't see past their own degree and into your problem, into your soul. And that's what I do. And that's how I've opened up those lines of communication. When I left Geisinger Health, which was probably one of the hardest patient populations to leave because those people were vulnerable for reasons that had nothing to do with skin color, nothing to do with, they were a forgotten group of coal miners and people in rural Pennsylvania. And I connected with them because I understood vulnerability. And this was I'm still an adjunct professor there because I could not fully leave.
That is wonderful. So in that moment, like what did that teach you about communication? Like when it comes to communicating with patients, when it comes to communication overall, what did that teach you about the role of communication when it comes to patient care?
Yeah, that it starts somewhere in your soul. It starts somewhere in the prayer that you do before you walk into the room to talk to them. It starts with ble asking for your words and your lips to be blessed at that moment. It doesn't come from the degree. It doesn't come from all the training. It comes from somewhere deeper inside of you. And I learned that, and every time I walked into a room, I made sure that I was prayerful before I walked in, and I made sure that I listened. So many of us open our mouths to tell them what's next instead of hearing what they're going to be able to tolerate, hearing their values. Thanks for that question.
Well, thank you, Dr. Gatson. Ashley K, I want to come to you with the pretty much the same question. So, just from the patient perspective, you know, when was that moment where there was a shift in communication where it really made a difference? Where for you, it was like, oh, okay, now I'm understanding what's going on, what's being told to me.
Um, that's a good question. I would say I had a recent moment like that. So back in November of last year, I got like more of my timeline with my terminal diagnosis, and I flipped out in the doctor's office. I'm very combative. I'm out my body. I'm angry. I'm wanting to flip everything over and just nothing was good. And one of the nurses comes running in the office with the doctor, like, "Do you want me to call security? Do because I'm combative. I'm lashing out." And my doctor tells her, like, no, like she's upset. She's more harm to herself than to me. Like, let me talk to her. And my doctor took time to sit with me in the little corner where I was so upset. And she spoke to me as if I was like her kid. It was like, hey, like, I see you. Like, let me help you the best of my ability. Let me hear what's going on. Like, verbalize with me, communicate with me so that we can find a plan that can help you. She was like, I know it's scary. She was like, but I need you to talk with me. And she talked to me like I was her kid. She talked to me like a human versus a patient. And she took time with me where she could have been seeing other patients, but she took that time with me instead of seeing me as a problem. She seen me as a person. And that all around changed my perspective of like the doctor patient relationship. and how when they're able to see us more as human, that helps so much with the care because we're not another number to them. In that moment, I wasn't just my social security number and insurance codes to her. I was a person who was hurting. And her ability to like reason with me in my place of hurting helped so much when it came to like the rest of the care.
Wow, that is a very powerful experience. I mean, just to follow up to that, from that experience, what do you wish, all healthcare providers across the board, um, you know, what would you know, what do you want them to know or understand just coming out of that experience?
I really want them to understand that we're human, that we're not like just a number or a test subject to test medications on or to just bypass when we're in your office, that we have lives after we leave, that I'm sorry, that if they see us more as human, that it would help so much because at the end of the day, you guys get to go home and rest your heads, but we have to go home and still have this diagnosis with us. So just having that human moment and bypassing like medication and all the jargon and just being like, okay, I see you. Because the biggest thing for me had to be my mental health. That was something that they never talked about that could be a problem, and I feel like if you just take time and just be human and just be present, it helps so much. It really does. I've heard it from other patients I've helped advocate with. I've in other socials, other like patients I've met just online doing social groups. They're like, if they just see us as human, it'd be so much better. And like I feel like I'm just a number in their office, and that's really a big problem.
Wonderful. Thank you so much, Ashley K, for sharing that experience. I know it can be, very difficult kind of continue to relive that and sharing that amongst other people, but I really appreciate you sharing that with us. Because we are coming up on time, unfortunately, I do want to get to some practical communication strategies. So, let's bring this into practice. Some simple but really powerful strategies can include using things like plain language, asking open-ended questions, pausing to check understanding, encouraging patients to explain information back, and then asking, what questions do you have? So these small shifts can really have a huge impact on how patients experience care. So just a couple of key takeaways. Shared decision making depends on clear communication and patient understanding. Health literacy really shapes how patients interpret and act on information, and providers really do play a critical role in creating environments where patients feel comfortable and empowered. So just going into our closing reflection, before we close, I want to leave you with two questions. What is one thing you wish every healthcare provider understood about helping patients feel confident in their care decisions? So this question is more so for any patients that we have on a call. And then how can we empower patients while ensuring their choices align with effective care? So as we close out and get ready to move into our Q&A portion, I really want the folks on the call to really reflect on those two questions. If you feel like you have an answer on the spot, feel free to drop them in the chat. Feel free to email them to us, but we really want to hear your thoughts on those closing reflective questions. So again, thank you all so much for your time and your insights and the work that you do every day. Yes.
I'm sorry, we have a few questions that were sent. So I want to make sure that we get to those.
Yes.
This is a question I think perhaps maybe Dr. Gatson can help. How can we, and maybe Lindsay too, how can we be successful using the concept of shared decision making with newly diagnosed patients? Given that sometimes patients are often overwhelmed when they first receive the diagnosis, and may not be able to fully understand treatment options or possible care pathways. What are some of the best practices that maybe all of you could share for particularly newly diagnosed patients?
I'd like to defer to Lindsay because I think she captured that very powerfully. Great question.
Sure. So, what my recommendation is to providers, and thank you, Dr. Gatson, is to as, assume that the interaction is familial and that the patient is your family member. Because Dr. Terry immediately went into auntie mode, and I felt comfortable and confident and not as overwhelmed at the onset of my diagnosis as I was weeks before when I received that daunting call. So just think that woman in front of you is your niece, your sister, your cousin, could be your mother. How would you communicate the news, the information to her? Just break it all down and reassure her that she will get through it.
Yeah, and there's no need to do it all in one visit. Helping them understand that this will be a journey and this is just the beginning and the finish line doesn't exist. We'll constantly be learning and moving through this, but showing them that it's together. But Lindsay, right on. So many times they teach us in medicine not to assume and don't cross lines and think of this as your family member. It's the only way. It's the only way to offer compassionate and evidence-based care because I don't want to get treatment that you wouldn't give to your mother. And to be honest, on some of the license renewal surveys for physicians, to renew your license, it says, would you go to this physician for treatment? So when a physician has to renew their license, they have to request that other doctors write a letter on their behalf or write a survey on their behalf to comment on their care. And it says, would you refer your family member to this physician? So if that's not proof positive that you better think about it that way, nothing is.
I do want to share that again on the support our Sisters with NBC website. We do have a guide, a helpful guide. We would love for folks to review and give feedback on for those newly diagnosed with stage 4 breast cancer. Sharing that resource for you. We received another question. It was, is there a higher rate of women living with breast cancer and HIV? Have you all seen any intersection of HIV and breast cancer amongst women?
So I'll just say that absolutely having HIV and a low level of lymphocytes opens up you for risk for mutations and cancers. So I could see that there's probably a powerful concordance rate between the two cancers and HIV, but there's potentially also things about a lifestyle that may predispose you to mutations and other risks, whether that be if this was HIV due to sexual intercourse or sexual habits, whether it was HIV due to having to have transfusions, and therein lies another condition that may predispose you, or if it was IV drug abuse, these different behaviors may predispose you to mutational risks, but certainly having low lymphocyte counts would predispose to cancers.
I know we have just about 1 or 2 minutes left. One question here. Understanding that it may be challenging to ensure patients have completed the requisite diagnostic testing prior to treatment discussions, please share some best practices that have been implemented to ensure that patients have diagnostic testing results available during their shared decision-making therapy appointments. So again, that speaks in some ways to what Ashley Kay shared, where the clinical trial was being offered without maybe truly understanding the kind of breast cancer she has, and even patients may not understand what type we were shocked to find within the MBC patients that we worked with that many did not know what type of NBC they have. And I don't know if that's widely understood. Anything that any of you could share about best practices about in communicating about diagnostic testing to identify type, subtype?
Lindsay, I know you're on mute.
Can you repeat the question, Adjoa?
But the question is basically, how can we encourage folks or help explain the importance of diagnostic testing to ensure that people understand their type of breast cancer before they engage in shared decision making?
And Dr. Gatson, I'll lean on you too. But what we do at Survivor is simply educate women about the importance of screening as it relates to early detection, also learning their breast density. I mean, there are a couple of factors that go into that, but I think educating oneself or educating patients about the importance of the diagnostic screening and making sure they have all of the information before even going to that appointment and connecting with their healthcare provider is important. So on our end, we're simply educating about the importance of screening, early detection, which saved my life, is so critical. But
Yeah.
Dr. Gatson, I'm gonna pass the pink mic to you to
Thank you.
answer that specifically about the subtypes.
Absolutely. Challenging your physician with questions about the screening. Patients go onto these patient blogs and you would be amazed. There's misinformation there, but the possibility of hearing it and asking for the truth is big. The last thing I would say is never fear getting a second opinion. Any good doctor would understand that a patient who wants a second opinion it can go one of three ways. Either they go get that second opinion and find out that you were right. They go get the second opinion and find out that the other person has the potential to learn from you because they may be off, or they get this second opinion, and the third possibility is that you find out that you need to learn something else. And I let my patients get second opinions because there's nothing but opportunity to grow, and that's how they get more information.
Thank you so much, Taylor.
Okay, I think we have answered all questions that were submitted to us. Again, if there are no more additional questions, or if you do have additional questions, please feel free to email me at tlopez@nmqf.org. Again, thank you for your time and insights. Again, if you have any questions, please feel free to reach out to me. There are some additional resources in the chat I see going. So thank you, Ricky Fairley. Again, thank you all and have a wonderful weekend.